2020. Since Monday, the physician's symptoms have worsened, and the physician has self-isolated at home. This physician is currently working with the Windsor-Essex County Public Health Unit in order to get tested. Testing is happening this afternoon, and we will not have the results for a minimum of 24 hours. To maintain the health and safety of our organization, our staff, and our patients, we have chosen to send anyone who has had direct contact with that physician home. These 22 staff members are self-isolating until we receive results from that testing conducted today. 8 Hotel-Dieu Grace Healthcare patients were in contact with this physician, and we have reached out to each and every one of those patients. It is our commitment to our staff, our patients, and our physicians, as well as to our entire community, that we will be providing updates when information is available. As such, we will provide a more detailed media update tomorrow. It is important for you as our media partners and for our entire community to know that Hotel-Dieu Grace Healthcare has been planning for an organizational response to COVID-19, along with our local partners who have been planning a regional response as part of the provincial response. Effective Friday, March the 13th at 5:30 a.m., our staff, patients, and visitors will notice some changes, and the following are the changes. These have been planned as part of our plan and are not related to the case that we have discussed just now. So the following will happen tomorrow morning at 5:30. Entry points to our main campus will be limited to the TAFOR building main entrance and Imara main entrance. So that's the building at the end of the roadway. Signage will be placed at all entry points, notifying everyone of that. Upon entering our hospital, each person will be actively screened. This means that everyone will be asked of any respiratory signs, symptoms, and travel history. Visitor restrictions will be going into full effect, with visiting hours changing to 8 a.m. to 8 p.m. We currently have a policy of open visiting and welcome families at all times of the day and the night. That will have to change for a period of time. This means there will be no visitors to our organization outside of 1 visitor per patient. There will be no visitors allowed under the age of 18. Palliative care patients in our Imara building will be allowed 2 visitors, and all visitor restrictions will be reviewed on an individual case for compassionate grounds. And again, those changes in terms of access to our building were planned as part of our response generally, and they were going into effect today, tomorrow, or on the weekend. That concludes our formal remarks, and Jeff and I will take any questions.
Why not, I know, I understand that you know who the physician is and who you may have come in contact with. Other than privacy reasons, is there not a reason to identify the doctor in case you missed a patient that the physician was in contact with? Recognizing that the physician is owed his own privacy, can you comment on that about why you're not naming the physician, just in case you missed a patient?
Yes. So the privacy of the physician is part of our decision-making, absolutely. But frankly, we're concerned with safety and security of our patients, our community, and our staff. So we have done a very thorough review with all of our staff, the physician, and determined that the list of patients that we have is accurate. The physician as well has not yet been confirmed. It is still, she is still in a situation where this physician is in the testing phase. The reason we will do another update with you all tomorrow is when we have more information about what the status of that swab is and whether or not we need to make any other changes or take other steps at that time.
You said 8 patients were in direct contact with this physician and other physicians were as well. How many physicians have been sent home?
No physicians have been sent home. There was 1 student learner that was in direct contact, and we've worked with the learning institution on that as well.
And what area of the hospital do they work in?
They work in this building, the TAFOR building. They work in the TAFOR, this building where we are in right now.
Do you know if they're a physician that works at both hospitals, like at other hospitals in the area?
This physician was only here at Hotel-Dieu Grace Healthcare and in our affiliated programs on the day, on Monday.
So they traveled back on the weekend?
They came back on the weekend
On the
from,
weekend, and
yep.
Can you tell us where they came from?
Yes, the physician traveled into an area of the country that is, of the world that is not under the travel advisory. This individual was on a cruise ship in the Caribbean.
Would you, is there one of you could make a statement in French? Is it possible?
Je peux tâcher, mais
Oh,
je ne parle
parfait.
pas français couramment.
Ok, merci. Est-ce que vous pourriez faire
Maintenant ou après?
maintenant, si c'est possible?
Si tu veux.
Oui.
Merci.
Seulement, la chose, c'est qu'il y a un médecin ici qui est retourné d'un voyage sans maladie. Il a retourné au travail lundi et durant le jour, il était plus malade et la soirée, il a une fièvre et il a isolé eux-mêmes, dans son maison avec son famille. Et nous avons notifié tous les patients qui sont contactés et nous avons identifié tous les travailleurs ici, les infirmières, qui ont en direct contact avec cet médecin et ils sont retournés chez eux.
Ça concerne combien de personnes?
8 patients et how many?
22.
Et
22.
22 des infirmières et d'autres staff ici.
Merci. What is your advice to someone out there who, regardless of all these details that we're gonna give them, are still panicking, thinking that they've come into contact with the physician? Should they be
Yeah.
calling you?
Yeah, so we've had a lot of conversation about that today. As you can appreciate, there's a number of things that the public needs to know and needs to understand, and they really circulate around some of the key messages we've delivered here. Is that we have contacted every single individual that has been in direct contact with this individual that at Hotel-Dieu Grace Healthcare. There is no secondary risk to anyone else at this point in time. Public health, we're working very closely with the public health department, and we'll take any additional steps they recommend if the swab from the physician comes back positive. At this point of time, we've taken all of the preventative and mitigation measures that we think are prudent and responsible. We will continue to update the public. This is a time for calm. This is not a time for panic. This is a time to pay attention to the professionals that have been advising a number of things. Wash your hands with soap and water a lot. Cough into and sneeze into your sleeve if necessary. Remain fairly distant from individuals if you can, so we're recommending to our own staff travel restrictions. We're asking them not to travel and to report in if they are traveling. And those are the kinds of things that I think really are important right now. We've just learned that the government has extended the March break for schools, and so there will be probably other changes as we go forward. Hotel-Dieu Grace and our partners in the health system will continue to inform the public as we need to. But this is something that we would have waited to come to you with, frankly, had we had more firm information. But unfortunately, in this time of social media, individuals are already talking about it. And so we wanted to give you the information we have. We've also sent out a memo to all of our staff to provide them with all of the information as well. And we've been working very closely with our Ontario health representatives across the region.
I think it's very important to understand that we have to get ahead of this virus. If we react to it when the cat's completely out of the bag, it's going to be too late. So the lessons learned, for example, from China was by locking down that first area, they probably prevented 1 million infections. That's a lot of people who would have been traveling and probably spread it even further around the world. So by taking these actions, the hospital is protecting staff, protecting patients, even without knowing for sure that this individual actually even has coronavirus, in a situation where it is much more likely that he actually has an influenza illness. But the symptoms are close enough and the situation is serious enough that you take very drastic measures. And it seems drastic, and I know there's a whole strain of thought in the community that says we're overreacting. It will look very bad if we underreacted and this turns out to be a serious, serious pandemic.
You did mention that it was a cruise ship. Is that where the concern comes from, if it was in the Caribbean, or is it because this individual was on a cruise ship that it raises concerns?
Actually, no, the only reason that there's concerns is that there was out-of-country travel and this individual has symptoms. And so we have worked and notified public health, and this individual, the physician, is being swabbed to determine whether or not there is anything to worry about. At this point in time, we don't know. We just know that this individual is ill with similar symptoms to what shows up for COVID-19.
And the rest of the staff here, did they report if they've gone out of country or traveling?
Yes. Yes.
So you're aware if there's anyone else that could be returning?
Yes. Yep.
If the test is negative, will you still maintain your current vigilance?
Well, you know, we were planning for this anyway. In reality, COVID-19 is going to come to every community likely in Canada. We've been expecting it. We've been working towards being ready for it. And so the steps we're taking were steps that we were going to implement at some point in time. And it could have been as early as tomorrow morning anyway, but we know that the public will have some concerns about the fact that this hospital and other agencies across our region are taking the necessary steps, and so we're doing what we need to do to reassure the public, to reassure our staff, and to reassure our patients that we are going to do everything we can to protect them.
What area of the hospital is he practicing?
This physician has been practicing within this building here.
Which specialty?
Psychiatry.
So was he or she in contact with any at-risk patients? I know there's certain people that are more at risk of this kind of virus. What is the case?
We've been working with public health to determine all of the patients to make sure that they're all contacted. So we have reached out to every single patient, and they've been given the appropriate instruction to self-isolate as well. And I don't know any more than that about the patients, because that is something that is still developing and it's still evolving. We may know more tomorrow if there's any other individuals that have symptoms, but at this point in time, we do not know that.
What happens for the relatives, for the people who live with the patients which are isolated?
So self-isolation is an interesting process. I'll allow Dr. Cohen to answer that question, please. He did a good job with our team today.
Well, you know, the transmission is very similar to influenza. It's droplets, which are basically fluid-covered particles of virus, and they're fairly heavy. And when you cough or sneeze, that's how they would be expelled from the body and could be potentially transmitted to another individual. These droplets are relatively heavy, and they sink. And within about 3 to 4 feet of the individual, there is no risk of picking this up. It's very different than some other diseases like measles or chickenpox or tuberculosis, which remain in the air for hours after they're breathed out. So it really is droplet precautions that have to be taken. So we do recommend that people who might be at risk and want to avoid passing the virus on, even though they don't know that they have it, but would like to take the precautions, is to sort of maintain a certain distance from the people you live with. Perhaps if you can sleep in a separate bedroom, use separate towels, etc., just to try to separate yourself somewhat from the people that you're in contact with.
Could you say that in French, please?
I could try.
Thank you so much.
Si les personnes secondaires veulent protéger les personnes avec qui ils demeurent, is that right? Yeah. On doit séparer un peu pour prévenir la transmission des petits gouttes d'eau avec le virus qui normalement tombent il y a 3 ou 4 ou 5 feet. Ça peut prévenir la transmission. C'est différent que les autres virus qui vivent dans l'air pour longtemps.
Is the physician of risk, what's the risk factor? I'm just thinking, are they older? Is there more of a risk? Are they more senior? There's been more concern if the individual being tested is of a senior age, or does that play a role in any of this?
No, the individual's age doesn't play a role in transmission necessarily.
No, I just mean in the person's health. I mean, if I'm thinking of the well-being of the person who is being tested right now, if they're of a senior age, obviously is it more of a concern?
The person in question is actually feeling much better. He still has recurrent fevers, but is feeling better. So I don't think we expect this person to become critically ill or seriously ill. I would say that based on the definitions of mild, moderate, and serious infection for coronavirus 19, he would probably fall into the mild or moderate category.
So can I say thank you for asking about that individual too? You know, I think one of the things that gets lost in some of these stories is that there are individuals who, this individual was trying to do the job that is required to care for people in our organization, to fulfill their professional obligations. And this individual is not a story or a case. This individual is someone that we care here at Hotel-Dieu Grace Healthcare very much about, and we have been very concerned about the well-being of this individual. So thank you for asking that question.
Can you comment at all? We've had a lot of discussions around the newsroom about coronavirus, and people are, should we be panicking or should we not be panicking? And you're saying don't panic, be
Nope.
calm. But all of these things are happening today. All these major things are being canceled, and life as we know it is, sure, there are the simple things like the NBA and the NHL, but isn't influenza on its own, doesn't it kill more people than coronavirus is on track for this year? Is this an overreaction by what we've seen coming out of China? Should we not have been worried about normal, old school influenza?
I wish everyone was worried as much as they need to be worried about old school influenza. I think one of the things that, as the CEO of a hospital, that continually frustrates me is the inability to have 100% of my team here accept vaccination for influenza. And we know that every year someone's mom, dad, grandmother, grandfather dies because influenza circulates in many ways unchecked in communities. So yes, that's a very good question. I think in a time of something new, this is a novel coronavirus, and speaking as a mom and as a grandmother and as an employee of an organization that cares for people, it's normal to be worried about something new. I think the general public is worried about something that's new, and that's okay. But I think this is not, the reason I say it's not something to be panicking about is because we have been, as a healthcare system, planning for things like this for a very long time. We've had a great deal of experience through SARS and through H1N1 and a number of other different times in our work as healthcare professionals to deal with the unexpected and the new, and that's what we do. It's what we all do. And so we've been planning for this, and like I said, the restrictions we're putting in on visiting and access to this institution are part of our regular plan anyway. That is what we do.
That's a very important question, and I think that the point is that instead of wringing our hands, we should be washing our hands. Instead of worrying about it, we should be doing the things that can prevent transmission. The second point I'd like to make is that we don't know where this virus is going. We do not know how long it will persist, how long it's going to circulate, how many people it will affect and infect, and it is quite potentially devastating. If it peters out, then we can just say phew, but it's only one of many viruses that come from bats that are ready and poised to enter the human population. So we need to be able to respond to these things calmly, effectively, and that is what the hospital has chosen to do here. Even though we haven't confirmed anything, we need to protect people. So yes, influenza kills a lot of people at about 0.1%. This virus looks like it's at least 1% or more. And Angela Merkel yesterday predicted that half of Germany is going to become infected. Well, you're talking about millions of people being sick and hundreds of thousands, if not millions of people dying, if we don't control it. So we need to get ahead of the virus. The province is setting up systems for testing. These things are all going to roll out, on an hourly basis over the next couple of days as the province begins to grapple with the enormity of what we could be facing. And we don't want to look back 5 years from now and say we could have faced it, but we didn't.
And so just one other thing to add to that, which is, if I was a member of the general public, and many of my family members are members of the general public, and I was seeing nothing happening, and I was seeing all kinds of things happening around the world and nothing happening locally and no decisions being made and folks not taking this seriously, that is the time to be worried. We are taking it seriously. We are planning. We are taking steps. We are making decisions. And that's what you should expect from your health system. And that's what we're doing.
Just for clarification, this isn't this is a presumptive case, or this hasn't tested at all?
The testing has just happened this afternoon.
So we're not calling this presumptive at all?
We are not, no.
Okay. And when would you know the timelines?
Sometime within we were told up to 24 hours to get the test results back. So we are doing what we're doing just in case.
Is it the health unit that does the testing?
Yes.
Public health.
Public Health Agency of Canada is arranging all the testing. We've worked with the Public Health Unit to arrange for the testing for the physician.
So are they sent somewhere, or is that?
Yes, it's,
Okay. They're sent there? They're sent to Toronto?
There's
a central lab.
No,
that does
The
this,
test is.
not the physician.
That's a whole other story.
No. The physician is getting swabbed
Yeah.
locally, and then the
Yes.
tests go to the
So
lab,
you
and then the
swab here at
results.
hospital, correct?
Not here. No, we don't do that here.
Who does the testing, who does the swabbing in Windsor?
There are a number of locations, I believe, where swabbing is happening. I actually don't have that information.
okay.
Public Health can maybe tell you that.
Does this physician lives alone, or he has a family who has to stay
Il a une famille.
in?
Oui.
The family is obviously, were they on a cruise with them? Are they being tested at all?
Yes.
They are being tested also?
Oui.
Oui.
How many people?
That's the private information of the physician, but we will say that the physician is taking all the responsible measures and working with public health to make sure everyone that's required to be tested is being tested. The physician is being extremely responsible and doing everything that this individual needs to do. It's a wonderful person, I'll just say.
I'll second that.
What's the difference between presumptive and, 'cause I think presumptive basically means, yeah, he's got it, we just, you know what I mean? I guess a lot of people are getting hung up on that one
Yeah.
word.
This is very important in the situation that all of North America and much of Europe finds itself in, is that there's not enough test kits. So, if everybody was demanding a coronavirus test, we would run out within an hour. So I'm talking about across the province. So there's an attempt by the provincial government to ramp up the number of kits we have to make them more readily available. But at this point, they're still a relatively scarce resource. So we are going to have a lot of people who are going to have the symptoms of coronavirus infection, which are 80% of people who have coronavirus will present with a fever, and about 50% will have a dry cough. Those are the two main symptoms. If somebody has the right situation with those symptoms, but we cannot test them and they're in isolation, you might call that a presumptive case. In other words, presumptive meaning a clinical decision as opposed to a laboratory confirmed decision.
Okay,
So we're
then
not-
why are you not calling this presumptive,
It
given that?
it doesn't matter. It's a moot point. The point is we're treating it as if it could potentially be coronavirus. The physician in question is being tested, and we will know the result. So whether it's presumptive or not, we're acting as if
It was.
it was to be on the safe side.
We're not in the position to make that
Right.
decision, so we have decided to, we're not the healthcare practitioners of the physician. So we are working with the physician and public health in terms of whether or not this physician is an active case.
Are the family members showing symptoms, or are they just being tested?
Yes, the family members have shown some symptoms, and testing is appropriate.
You said that 22% who work here are isolated too, right?
The 22 individuals have been contacted and have been asked to self-isolate, and they are doing so.
Okay, so how percentage of your, yeah, are they all nurse?
No. We have a wide variety of professions that work here, and so all of the individuals, they come from different employment groups. We have approximately 1,200 employees across this organization that work here at Hotel-Dieu Grace Healthcare across all of our programs, and the 22 that have been self-isolating at this point until we know. They may come back to work after we get the test, and they may require further isolation after the test results if it comes back positive. I think that's probably good. So what we'll do is we will be gathering more information, and our communications team will send out updates as we get them. If we don't have any news to share with you tomorrow, we won't call any kind of a conference, but if we have updates that are relevant, that are relevant and significant, we will have another press conference around the same time tomorrow. Thank you all for coming.
So if anybody has any other questions, I'd be glad to take them on the side.
Presumptive means the principal on one side, goes to the other side, yes.
22 employees were contacted. Some were working today and were sent home. Some were told not to come in.
Okay, because I've been put on, I think, the asked
This is
clarification, you
definitely
said no one was, none of the employees or something, but there was 20. I might have missed
Question
it.
is the patient has.
Hey,
All right, 22
Yourself?
employees totally. Some were working today.
But that's okay, just a general number.
The total number of employees is 22.
Some,
And eight
okay,
patients.
some working.
Yeah, and some, yeah, some.
just over here, right?
JFF,
All
is that right?
22 had,
What's your last name?
Yes, yes.
came in late, so.
Direct contact, not some kind of contact, direct contact. Okay, thanks all.
Please spell your last name for me.
You know my title, so you guys know me. No, I'll get you this.
Director of what?
No, there's nothing in here.
Rehab.